This is week 6 project on patient's perspective. For this week's project, our group has chosen the story of an airman, a stroke survivor, a life punctuated by commas. The story of an airman, a stroke victim, was the story of our Brady Johnson from Belvidere, Illinois. Nicknamed the Freak, Brady was a combat soldier who served and did 2 tours. A 30-year-old prior to suffering from stroke, Brady had been an active and athletic professional, which includes a daily routine of running for 6 miles while suffering from headaches. Increasing and progressive headaches had made him sought medical advice one Saturday morning. Running every day with a headache, Brady's physician initially diagnosed him with a cerebral hemorrhage about half-dollar in size. He was then rushed to Chicago after being seen by a neurosurgeon. The loss of blood and fluids caused him to stroke out during operation when he underwent surgery to stop the bleeding. From our patient's perspective, our Brady Johnson, he thought life after stroking during operation as the end of his life at the age of 31. He can no longer walk again without aid, enunciate words, or cannot have any children. This is devastating as Brady was already planning to get married. From the clinician's perspective, the physicians that treated him thought that he should be in no way should have been alive having suffered cerebral hemorrhage while running 5 to 6 miles every day. Prognosis is poor after recovery from surgery, but his healthcare team still decided to send him for rehabilitation due to the age. After beating all odds with the kind of prognosis he had, Brady started running a 5K again, got married in 2005, and eventually had 2 kids. Brady suffered another setback when one day he started suffering from a new round of intense headache. This time he went to the Mayo Clinic to meet a team of neurologists who determined the cause of his headaches, which showed residual fluid particles and scar tissues from the last operation he had. Relevant domain. The first domain we wanted to tackle is the patient provider factor. Brady's story takes a turn for the second time around when he suffered a more intense headache after his stroke from the operation which led him physical disabilities the first time around. Patient-provider communication, the second time around at the Mayo Clinic, provided a better communication of pros and cons that he had to face the second time around. Brady indicated that the physician he saw prior to the Mayo Clinic were not able to identify the causes of his headaches. With varieties of tests and set of neurosurgeon working now with Brady, they are able to find the cause of headaches the next time around. The shared decision-making was forged from the time that he entered the Mayo Clinic, as all his previous experiences were taken into consideration and became a part of his decision-making. The second domain, which is the provider, patient, and healthcare system factors, allowed Brady to access physicians in his community that never really had that physician from the very first time he had the incident of headaches. This time around, Brady was able to access physicians that are well within his community, and since his headache could not be eradicated completely the second time around, it was a blessing in disguise that his physician is actually close to his home that allows him to live every day with better quality of life. The care coordination and the coordination of care provided him a good understanding of how collaboration of care between healthcare providers, healthcare setting, and how it works after he experiences it in the Mayo Clinic. He knows that patients' life and quality of care is taken into consideration for better improvement and coordination of care. Despite the loss of sensation in Brady's arm post-stroke, and against the poor prognosis of his neurologist the first time around, he coaxed his body to do things that his rehabilitation team told him he could never do again. Brady refused to give up. He changed his body, his mind, and heart like an Air Force fighter. He fought the stroke. Through his efforts and determination, he began to talk through singing and walk the aisle to marry his fiancée. He eventually had two sons with his wife and started running again. Providers should work with patients to utilize treatment that includes patients' health related values and patient preferences. Brady's story actually defied all odds during his recovery from stroke. He took actions to challenge his physician's poor prognosis, won the battle against stroke, and achieved several goals. Needless to say, the patient's preferences, which is Brady's preferences to achieve goals, made a difference in how he had recovered the first time around. In addition to the lack of sensation on the right side of his body, Brady's headache came back again. The doctors could no longer help him achieve comfort. He became hopeless and despaired. At the Mayo Clinic, Brady felt a sense of relief and hope because the cause of his headaches were identified. He felt the confidence in his physician because he was engaged with his plan of care from diagnosis to the plan of care. He felt he was added into the answers at the everyday decision and felt at home. Through effectively promoting patient engagement, all healthcare providers can enhance positive outcome, safety, and avoid malpractice claim. Medical encounter significantly changes when provider moves from focusing only on illnesses to focusing care on patients' needs. At the other clinic, Brady was told that his life was over. He was shocked and angry. On the other hand, the Mayo Clinic made him feel okay with words of reassurance and partnership with providers. He stated, "It made me feel like we can move forward like I've never found before." Solutions. One of the things as providers that we have to consider is the trust or distrust of our patients. Patients who perceive positive characteristics in their providers are more likely to seek treatment and medical advice. Collaboration and satisfaction in patient provider relationship are associated with patients' participation in their care, fewer appointments, cancellation, and no shows, and improved outcomes. In Brady's case, he experienced a severe headache again, and when he consulted the Mayo Clinic, a team of neurologists explained to him what is causing the problem. Health communication, improving health literacy to protect patient safety, communication, problems among healthcare providers, patients, and families are the most common and leading root causes of adverse outcomes. Communicating healthcare literacy will help individuals to obtain, process, and understand basic healthcare information and services to make appropriate healthcare decision making. This has become the primary objective of many healthcare systems in order to protect patients from harm. Providers to respect patient preferences and promote their active participation in clear clinician decision making to the extent that patients feel comfortable and are willing to take part. Patients may be able to discuss their preferences and available options as well as making final decision making about treatment. Many people of color and those with lower socioeconomic status reports problem with shared decision making and respect for their preferences. African Americans and Asians more frequently report under involvement in healthcare decision making. Patient provider and healthcare system communication should be enhanced. In Brady's experience, for example, the first time around, he went from one physician to the next, not knowing what's the cause of the headache after his stroke. The patient preferences were actually not taken into consideration the first time around. In the second time around, when Brady had a more intense headache, the Mayo Clinic considered making sure that aftercare within the Mayo Clinic after his second operation and after having to send him home, realizing that the patient would no longer have a quality of life with not no longer suffering from headache is impossible. The Mayo Clinic provided Brady with a physician within his community to help him manage and decrease the effects of headaches as part of his quality of care. Better communication and enhanced communication within the healthcare systems and the links within the provider and the physicians within the community should enhance patient care, such as in the case of Brady. The next solution should be looked at is preferences as far as racial concordance is concerned. Patients who has physicians of the same race or ethnicity respond very well to treatment. This is true because of patients are able to understand and are more comfortable in asking questions regarding their health. Increase in physician and patient communication is also observed in this setting because of the understanding of cultural differences within that same in race and ethnicity. Another solution should be also looking at interpretive services. In case of a physician patient, same race, same ethnicity are taken and can be provided, interpreter services should be taken into consideration to give a better experience with care, better understanding of the diseases and treatment. Lastly, another solution is making sure the access to care is provided to the patient as well as establishing a transdisciplinary professionalism. In case of Brady, the set of neurosurgeon were actually assigned to Brady as well as another set of interdisciplinary professions that were able to help him access physicians and resources within his community where he lives. Improving this and making changes to this within the healthcare system and looking at domain first and second domain issues within that healthcare system increases shared decision making and better understanding that can be integrated into education, practice, and ethical implication, as well as decreasing the barriers that is impacting evolution of professional context within patients, students, and others working within the healthcare system. Lastly, our last slide includes all our references.